Hello and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class healthcare provided at each of our Regional Health Command Atlantic medical facilities to soldiers, their families, retirees, and other beneficiaries. This month, we come to you from Joint Base Meyer Henderson Hall, Virginia, home of the 3rd U.S. Infantry Regiment, better known as the Old Guard. Andrew Rader Army Health Clinic is charged with maintaining the health readiness of all soldiers, including those of the Old Guard, their families, and other beneficiaries. Today, we will look at some of the ways Rader helps ensure that the Army is ready when the nation calls. First, we visit with Rader's Readiness Clinic, where soldiers get physical exams and select specialty care services that keep them fit to fight.
Rader Specialty Clinic is now the Readiness Clinic. The name change signaled a change in focus that mirrors the Army's highest priority.
So medical readiness feeds right into mission accomplishment.
That focus on mission accomplishment is built into all care provided at the Readiness Clinic.
I mean, it's key for us to have our soldiers and service members medically ready in order for them to perform their mission. Without being medically ready to go, you simply aren't going to be able to deploy to accomplish the mission, and again, that's our primary task.
The Readiness Clinic provides physical exams, occupational health, vision and hearing care, well-woman care, immunizations, and the Exceptional Family Member Program. These clinic sections work together to support the medical readiness of soldiers and families.
So you'd set up an appointment for whatever section that you need, and then depending on how that appointment goes, that section may update their specific part of readiness, or they may do that, or they may refer you to another section if they notice that some other part of your readiness is not complete.
Patients can make follow-on readiness appointments with different sections within the clinic, enhancing their access to timely care. Reporting for the Regional Health Report, I'm Sergeant First Class Aisha Austin.
We are fortunate to have the commander of Andrew Rader Army Health Clinic, Lieutenant Colonel Ed Weinberg, with us today. Sir, thank you for joining us.
Thanks for having me.
Why did you convert Rader Specialty Clinic into the Readiness Clinic?
With the Chief of Staff of the Army's #1 mission being readiness, we knew that we had a collection of specialty services that were all a bit disjointed. So late last year, what we decided to do is transition it to a Readiness Clinic. What that basically means is for our soldiers and also our civilians and family members, anything that has to do with their readiness is now located in one centralized facility.
Well, the Rader Outpatient Pharmacy didn't get a new name, but it has seen great improvement in customer service this past year.
So we've made several big improvements. Within last year alone, we fulfilled many vacancies. We had several staffing vacancies, so we fulfilled those, and then we also opened a 6th window, which we dedicated as strictly a refill window. So now we have 6 full operating windows, and that allows us to increase our throughput by 20% and decrease overall patient wait times. So we have the Script Pro robot. It's a pharmacy automation machine. It's actually capable of filling and labeling prescription medications for us. It fills and labels about 40% of our daily prescriptions every day, and then the other feature of it is the barcode technology, so it could track 100% of all of our prescriptions by scanning the medication, and it just ensures safety. You know, safety is the #1 feature that the Script Pro provides. So when you scan a medication, when the technician fills it, the computer will show a picture of the medication, so that way you can verify that the medication that you're filling is actually the same medication in the bottle, and it's all by NDC numbers. So it's very specific. And then for the pharmacist as well, we can actually scan the prescription in, so it makes the hard copy prescription easier to check. I pulled some numbers. We did over 200,000 prescriptions in the past year alone. Daily, it's about between 400 on some really busy days, 500 prescriptions a day. So ultimately, we're ensuring our military force is healthy, and they are ready to go out and do the mission that they're assigned to do, the ultimate mission. But beyond that, we also contribute to the retiree and the dependent population and as well to improve their patient health outcomes. It all just goes back to readiness.
Lieutenant Colonel Weinberg, the pharmacy chief told us about the great volunteer support you're receiving here. Can you tell us a little bit about how that's affecting your ability to achieve your mission?
Sure. So our pharmacy is extremely busy, being in the center of the National Capital Region. It's also very conveniently located right next to the commissary, which offers ease of parking for both groceries as well as coming in to get your pharmaceuticals. Our volunteers have really stepped up to the plate. We've increased our pharmacy volunteer hours by over 100 per month as of last summer. And what that's allowed us to do is actually open up a new window. We now have 6 windows versus 5. And for the most part, our volunteers run the entire refill pharmacy operation.
Physical injuries can play a major challenge to soldier readiness. Physical therapy clinics, like the one here, play a major role in staving off injuries and accelerating recovery.
We need to do what we can to help those folks who are already injured get back to a level of readiness where they can come off a profile, pass a PT test, and be deemed medically ready and deployable within that 72-hour window. We will consider ourselves as consultants to the patient. Oftentimes there's a perception that you go to the doctor and the doctor tells you what to do. We certainly like to pursue a patient-centered approach. There are individuals who may come to us and say, "Listen, get me as far as you can get me, but I'm not interested in surgical intervention," and we respect that. We'll certainly do as much as we can with them to get them up to the highest level of readiness that we can. Really, we have 2 primary functions, and the first is a direct patient care mission. Our primary bread and butter, as far as military physical therapists are concerned, is managing individuals with musculoskeletal injuries. I looked at some statistics that were put together by the Office of the Surgeon General, and it looks like it's approximately 76% of the individuals who are medically non-ready actually have musculoskeletal injuries. The other part of our mission then is more of, we phrase it, injury prevention or human performance optimization, to make recommendations on how they can train their personnel in a way that won't break their personnel. So if we're demonstrating that, certain types of interventions can help people perform better in terms of the Army's primary metric for physical fitness and performance, then that's a good thing as well.
What is the overall role of facilities like Rader in soldier readiness?
So as a health readiness platform responsible for all of the soldiers and civilians that are both at Joint Base Meier-Henderson Hall and Fort McNair, we're responsible for their care. We work with our partners here on the post to include the Old Guard and their leadership, as well as the others that attend the Community Health Promotion Council, in seeking ways to just improve the readiness of all the soldiers, sailors, airmen, and Marine that are assigned to this area.
What plans do you have to further improve readiness?
So we're working with post leaders to include the base commander as well as the Old Guard leader and others that attend our Community Health Promotion Council. One of the things that we'd like to do is improve the readiness of the force here as far as medical. We know that that's the #1 priority of the Chief of Staff of the Army. We take it very seriously. One of the other things that we're doing is working very closely with the Old Guard and their population from a physical therapy and behavioral health sense. They might not be authorized all of the embedded assets that a typical brigade combat team might, but we try to embed our folks as much as possible to bring the care far forward to them so that they're taken care of.
Lieutenant Colonel Weinberg, thank you so much for taking the time to be with us today.
And thank you, Ann, and to all the other partners we have at the region for assisting us in the things that we do.
And that's the Regional Health Report for February. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Thanks for joining us.